Did you know that liver diseases, including cirrhosis, claim approximately 2 million lives worldwide each year? That's almost the entire population of a small country. These alarming numbers underscore the gravity of liver damage and the critical need for early detection. Yet, the silent nature of such diseases often leads to late diagnosis. Many people don't realize they have liver damage until it's too late. But, your skin might be trying to warn you. Stay tuned to find out how. The liver is a workhorse in your body. When it's in trouble, your skin often sends the first SOS. From jaundice to spider angiomas, there are 12 distinct skin signs indicating your liver may be under duress. Recognizing these signs is paramount. Why? Because the sooner you detect a problem, the sooner you can take action. Knowledge is power, and in this case, it could be the key to safeguarding your health. Let's delve deeper into these signs to help you stay one step ahead in your health journey. The first 4 skin signs could be easily mistaken for common skin conditions, but combined with other symptoms, they might indicate liver damage. Our journey begins with the most well-known sign of liver damage, jaundice. This condition manifests as a yellowing of the skin and the whites of the eyes. It's caused by a buildup of a substance called bilirubin, a byproduct of red blood cell breakdown. When the liver is functioning properly, it filters out bilirubin. But a damaged liver struggles with this task, leading to jaundice. Next up is pruritus, or itchy skin. Now, itchy skin might seem like a harmless annoyance, but when it's associated with liver damage, it's far from a mere irritation. It occurs due to bile salts accumulating in the skin. Bile salts are substances produced in the liver that aid in digestion. However, when the liver's function is compromised, these salts can build up, causing itchiness. Moving forward, we encounter palmar erythema, a fancy term for red palms. This condition is characterized by reddening of the skin on the palms, especially the thenar and hypothenar eminences. That's the fleshy parts of your palm below your thumb and small finger. Palmar erythema happens because of a change in hormone balance caused by liver disease, leading to dilation of blood vessels in the palms. Our fourth stop is at spider angiomas. These are small, spider-like blood vessels visible under the skin. They get their name from their appearance, which resembles a spider with a central body and radiating legs. Spider angiomas occur due to an increased level of estrogen, a hormone that promotes the growth of blood vessels. In a healthy liver, estrogen is appropriately metabolized, but in a damaged liver this process is disrupted, leading to an excess of estrogen and the formation of these spider-like vessels. If you notice any of these signs, don't panic, but do consider getting checked out. After all, your skin is a mirror to your internal health, and paying attention to these signs could be the first step towards ensuring your well-being. The next set of skin signs are more specific and could be a stronger indication of liver damage. Moving on, we've got purpura. This is a condition where bleeding occurs under the skin, causing purple or red spots to appear. They can range from tiny pinpoints to large patches and are often found on the legs and arms. The reason behind this symptom is the liver's diminished ability to produce clotting factors, which are proteins that help your blood to clot. When these factors are in short supply, even minor injuries can lead to significant bleeding under the skin. Next up, we have ascites. This is a rather uncomfortable symptom where fluid accumulates in the abdomen, causing it to swell. This happens when cirrhosis, a late stage of scarring of the liver, prevents normal blood flow within the organ. The increased pressure in the liver's blood vessels forces fluid into the abdominal cavity, resulting in ascites. Third on our list is caput medusae. This might sound like something from a Greek myth, but it's actually a term used to describe swollen veins that appear around the belly button. The name is derived from the Latin for head of Medusa. And if you're familiar with the mythical Gorgon, you'll understand the comparison. This condition occurs when the liver's damaged and scarred tissue obstructs the normal flow of blood, causing it to divert through smaller veins, leading to their visible swelling. Lastly, for this segment, we have Terry's nails. This is a condition where the nails turn white with a band of darker color at the tip. It's named after Dr. Richard Terry, who first identified this sign. The exact cause of Terry's nails isn't completely understood, but it's often associated with chronic diseases, including liver cirrhosis. Recognizing these signs early on could be a lifesaver. Let's continue with the final set of symptoms. The final 4 skin signs are less common, but they're still worth keeping an eye out for. Let's dive into these deeper waters of understanding. We start with Dupuytren's contracture. This condition is characterized by a thickening of the skin in the palm of your hand, causing one or more fingers to bend into the palm. This occurs due to an accumulation of harmful substances in the liver that are not properly eliminated, leading to their deposition in various tissues, including the skin. Next on the list is fetor hepaticus, also known as breath of the dead. Sounds scary, right? This condition produces a musty or sweet breath odor. It's caused by the liver's inability to break down a substance called dimethyl sulfide, giving the breath its distinctive smell. Our third sign is gynecomastia, which is breast enlargement in men. This happens when the liver is not able to metabolize hormones efficiently. The result is an imbalance with higher levels of estrogen causing breast tissue to grow. Lastly, we have the loss of body hair. This can occur due to hormonal imbalances caused by liver disease. Remember, the liver plays a crucial role in metabolizing hormones, and when it's not functioning well, various signs can show up on the body. These signs might not necessarily mean you have liver damage, but do take them as a signal to seek medical advice. So, now you know the 12 skin signs that could indicate liver damage. From jaundice to spider angiomas, palmar erythema to Terry's nails, and 6 more, these signs are your body's way of giving you a heads up. Don't ignore them. Regular health checkups and early detection are vital. It's your body, your health, your responsibility. Remember, your health is in your hands. Stay vigilant, stay informed, and take action when necessary. After all, early detection can make all the difference.